Is our next patient, aged 27. Very interesting case again, where we gave emphasis on the etiology. His inability to speak, inability to hear. He's coming from a very rural area, and they're mentioning that harm kobe hoyechilo? At age of 8 years, he had measles, right? But unfortunately, they took him to a local hospital and they gave him shots for tuberculosis. Injections for tuberculosis. Right. So it was a misdiagnosis, and they took him to not a proper medical doctor, and he thought it was tuberculosis, and they gave him shots for tuberculosis. And the speech and hearing deteriorated after that. You understand what I mean?
Yeah.
So the mom is not sure if the measles caused the speech and hearing to become this, or it was the tuberculosis injections, right? You understand, this is the fallacy sometimes when you stay in a very rural area, you have people like that who treat in this way. So that was a major thing which he came to us with, difficulty in speech, difficulty in hearing. He used to also have breathing difficulties. He works with the Indian spices in a shop where there's a lot of Indian spices, so there is exposure to dust because of that as well. And the breathing difficulty flares up from that. He sweats quite a lot. He's a mild, calm boy who has fear of thunderstorm, fear of loud noises. He likes spicy and sour. Dust aggravates the condition. I gave him pothos as an acute. You recall I've shared this medicine with you, pothos fetidus. P-O-T-H-O-S. I want you to please have a look in Borike for this medicine. If you haven't shared this with you, fantastic medicine for dust allergies. You can use this in tincture, you can use this in 6C, whenever there is strong aggravation from dust, right? You get this so often in today's modern day world, when they have a dust flare up, and even house dust, they have a flare up from that, you can use pothos as an acute. They tell you whenever I go into a dusty area or I'm cleaning my home, that dust flares it up, I need to take my inhalers. You ask them, don't take that, take pothos instead. Right? Tincture or 6C, pothos fetidus. You can put this in your clinical tips for dust allergies, please. You missed out on anything? Fear of thunderstorm, fear of loud noises. পুরো নাম? পুরো নাম কি? ঠিকানা? ঠিকানা জানে? বাবার নাম? বাবার নাম? মায়ের নাম? মায়ের নাম? বৃহস্পতি। তো ভাইয়ের নাম কি? You understand, speech is there, but Mom is saying previously he couldn't tell these names as well. He used to only could tell his own name, but that has improved. Again, you see a case where we are emphasizing on etiology, right? Week 1 we have shared with you different cases, how we are going about it. Week 2 I'd like to emphasize with you on the angles of prescription. What are the reasons, or in which area we are giving emphasis on prescribing. Case 1 I shared with you where we are prescribing on etiology. Case 2 here also we are prescribing on etiology. The two factors were there. One, there was a history of measles. Second, there was a history of the anti-tubercular medicines, right? So we have to take both into account, because the mom was unsure whether it started one or before that. Measles was given earlier. Measles he had earlier. After that, there was anti-tubercular drugs, right? We get cases, to be very honest with you, where you can have poor speech, poor hearing even after measles or even after anti-tubercular drugs. So even from the medical point of view, we are not sure if it started from one of the either. You understand what I mean? Right?
say you gave Malblanum.
Yeah, yeah. I'm coming to that. We started in 2018 with streptomycin. Streptomycin is the common remedy or common medicines which is used in the subcontinent for tuberculosis. That's the conventional medicine which they use for tuberculosis, right? And streptomycin is available in potencies and pharmacies. I write the name of the medicines. So ever you come across patients who have suffered from bad effects of anti-tubercular medication, please do remember this medicine, streptomycin. Streptomycin, S-T-R-E-P-T-O, streptomycin, M-Y-C-I-N, streptomycin. It's not in any Boricase or Allen's. If you need more information, do let me know. I'll send you detailed handout of that as well. Streptomycin is a very useful medicine. Any bad effects, head to foot, you name it, any after effects which start as a consequence of anti-tubercular medication. We started with 200C followed by 1M. Because A, we are prescribing on etiology, right? B, you understand there is neurological deficit as well because speech is getting affected, hearing is getting affected. It's not totally deaf and dumb, right? So there is speech, there is hearing. You could see that the mom prompted, he could hear it and he could speak after that, right? So there is that speech and hearing deficit is there. So because it is neurological, we start with 200C followed by 1M. We start with 200C followed by 1M in 2018 June. We have gone up to 10M with streptomycin, and then in Feb 2019 we changed the plan of treatment to morbillinum.
Was there already some change?
Yes, with streptomycin there was change. I'm just sharing that with you. Speech had become a little clearer with streptomycin, right? He could say a few more words, but hearing there hadn't been any change with streptomycin. I'm sorry. Spasm had been better. He used to have a lot of dust aggravation. That had reduced with streptomycin as well. He used to spit quite a lot, which I didn't mention earlier. That spitting had reduced with streptomycin. Because the hearing hadn't changed and I had gone up to 10M, I thought of, maybe streptomycin has done its bit. Let me change to morbillinum, because you understand measles can be also a factor for developing these symptoms, right? We changed to morbillinum 200C followed by 1M, and immediately after morbillinum, hearing started to get better. There had been no 0% change with hearing, but with morbillinum, the hearing had started to improve. Last prescription was 10M in November 2019 with morbillinum. We had given 1M twice, followed by 10M once. You have heard this from us last week. 2 doses of a particular potency works best. Kent mentions this in his lesser writings. I want you to go have a read through this chapter, please, when you go back. Series and degrees of potencies. There's a wonderful chapter of Kent's lesser writings, series and degrees of potencies. There he mentions that 2 doses of a particular potency works best. When you have exhausted its action, you can go higher up, you can go lower down the chain, right? Series and degrees of potency is Kent's lesser writings. We don't do the 200 again, we do the 1M again. You understand, we gave 200C followed by 1M.
Yes,
and then he's better, we boosted. Again symptoms came back, we repeated 1M again.
Okay, then the 1M.
Yeah. Okay. We don't go back to 200 again. Okay. Generally, when you are prescribing for etiology, we don't do that. Okay. But you can do that, you can do that. It's not an issue. You can give 200 followed by 1M again.
You can give 200 twice and then 1M?
No, this is, I'm talking if there is a history of the etiology.
So why should we not do?
This is mentioned by Phobister, that whenever you're prescribing on etiology, you prescribe 2 succeeding potencies.
Yes, I've heard this in every class, but I don't
That accentuates the action. Whenever you have prescribed a 200C, if you just leave it with 200C, when he comes back, sometimes there is improvement, but there is again relapse. But when you give the 1M, it just removes the blockage and there is continued improvement with 1M.
Does that mean that the 200?
But you can do that, That's not a hard and fast rule that you cannot repeat 200. You can again repeat 200C again. That's fine. Because whenever you're prescribing any potency, you can always go down the chain, you can go always higher up.
But at 200?
No, because again, because when you're prescribing on the etiology, you're giving the succeeding potencies. That will accentuate the action. But whenever you're prescribing without an etiology, you can always repeat 200C twice, right? So because the etiological factor is there here, that's why we are going to the next potency. We're not repeating 200 again. But if the etiological factor is not there, you can always repeat 200C again. There's no hard and fast rule you can't. Because the body is sensitized to the 1M, right? So whenever you're giving a 1M and he's improving because of that, then you can always go higher up the frequency, right? But if you're giving to 1M and it got a flare up, you can always drop down the scale, you know, because maybe the body is not sensitized to the higher potency, so you can drop down the scale as well.
And you also have to
Okay.
see vitality. And
Yes, exactly. You have to see how the reaction with the potency as well, you know. That depends on your next choice. Will it be a higher potency or you can drop down as well?
So at 200 itself, if we notice an aggravation, can we drop down to 30?
Yes,
then?
definitely,
Based on
yes.
etiology?
Based on etiology, yes, definitely. You have given a 200C followed by 1M. If I would have seen an aggravation with the 200 followed by 1M, I could have dropped to 30 followed by 200.
In this case, what would an aggravation be? What
His spasm would have aggravated, right? Because you have to see the present symptoms. His speech and vision, hearing, there's no chances of aggravation with that. But the spasm is a symptom which can have flared up.
so that would have gotten.
Yeah. So that will be a guideline to see if there is change. Spasm is much better because he is working in a dusty environment. So the mom says the occupational factor is there. So sometimes it happens the dust flares up his condition, but pothos helps him whenever he gets an attack. শুনতে কানে শোনাটা
যেমন ছিল তেমনই আছে।
কতটা পরিবর্তন হয়েছে প্রথমের থেকে?
একদম আগে মনে ছিল এখন ওই কানে জোরে আওয়াজ হলে বলে একটু আওয়াজ।
He says, mom says that even if she is standing in that distance, earlier he couldn't hear it, but now you saw he's standing in from that distance, he can understand little bit of what mom is saying. So total first এর থেকে here শোনাটা কতটা পরিবর্তন হয়েছে? 10-15 ভাগ. You can hear a little bit better. I was asking about a percentage, she couldn't say that. Speech, কথা বলাটা? Speech, the mom says, has improved much with the medication. He can say even more others people's names like his brothers, his parents, which he couldn't say that earlier on, right? So that has been an improvement. Once I will repeat morbillinum later on again, right? And then I will do again a recase taking to assess about a constitutional remedy. I have to prescribe anti-tubercular medicine for him, you understand, because dust is a factor as well, dust aggravation, right? We're boosting today. Generally see him after 4 to 5 weeks time because sometimes he gets an aggravation of the bronchospasm. So I generally follow up him in 4 to 5 weeks time.